So the main takeaway from this article is the clinical application of pharmacogenomics that will most benefit most practitioners. Healthcare providers are currently being bombarded by a number of patients who are interested in utilizing pharmacogenomic test results to make clinical decisions. And what we strive to achieve with this article is to help or assist current practitioners with the best way of handling pharmacogenomic test results that they may be seeing in their practice. Hi, my name is Eric Mate. I'm a clinical pharmacogenomic pharmacist here at Mayo Clinic. I work closely with our Department of Pharmacy as well as our Center for Individualized Medicine, with a major interest in the translation of pharmacogenomics from research to the bedside in improving patient experience when it comes to their medications. Now, the name of this article is Considerations when Applying Pharmacogenomics to Your Practice. And as the title clearly indicates here, this has to do with the clinical application of pharmacogenomics that may improve upon the practice settings of various clinicians. Pharmacogenomics is an additional tool that can be added to all the tools that clinicians have in improving the medication experience for their patients. Within Mayo Clinic, we do have the Center for Individualized Medicine that has one of their core goals of missions is to ensure that every patient that walks into our facilities, either here in Rochester, in Arizona, or in Florida, as well as within the health systems, is that these patients will one day walk in and have a pharmacogenomic testing done preemptively, right? And one of the things that we've already done at Mayo Clinic has to do with the Right 10K pilots, whereby Mayo Clinic, through their biobank, offered pharmacogenomic sequencing for over 10,000 patients, and their results are currently embedded in the medical record or in our medical record for rules to fire to help improve or decrease the potential for medication side effects or adverse drug reactions. I think today, the findings, if you go back and you look at some of the practical applications when it comes to medications like metoprolol, codeine, tamoxifen that are mentioned in the article, you realize that these medications, most of the ones I just mentioned, are metabolized by CYP2D6. And we're currently applying some of the knowledge in practice to improve upon the medication selection and avoiding major adverse reactions that some of these medications may cause for our patients. When I talk about major side effects, usually we'll be looking at the HLA genes that can cause hypersensitivity reaction. And this is where, if you go back into the article, there's a mention of the HLA genes being a gene that sometimes you may want to have testing done, especially if you're looking at a medication such as abacavir, before even prescribing the medication to prevent hypersensitivity reaction. At the end of the day, the article is sharing more light on the variability in the genes of patients that can help predict medications that can be selected to improve, again, specific conditions that patients may be afflicted with. If we think about disease states such as mental health, which is a major issue today, so say depression, there are patients who sometimes will have to try 3 or 4 medications to find the right antidepressants to help them manage their mental health. And in the case of pharmacogenomics, this is, again, like I said in the beginning, a tool that can be utilized in helping to select the right medication potentially sooner compared to the try and error that has been done in the past. So the next steps in line for this research is continuing to collect data based on the clinical application, the 10 steps that are mentioned in this article, collecting data and ensuring that as the science improves, these 10 considerations continue to align with the changes that will be happening in the future. Thank you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.